Good afternoon. My name is Melissa Nordine, and together with my colleagues Janice and Lauren, we will be sharing our health promotion program, Diabetes Care Fair, identifying community risks and resources. Here's our table of contents. A little background about diabetes. Type 2 diabetes, by 2040, 642 million individuals will be diagnosed. Over 5 million deaths have been attributed to this worldwide. The estimated cost for type 2 diabetes is approximately $227 million annually. And in the US, over 11% of all adults have been diagnosed with this debilitating disease. Increased rate and cost have public health officials looking to reduce the burden of the complications attributed to this disease. Our mission is to organize quarterly community health fairs to increase awareness and empower communities by making type 2 diabetes education accessible, including prevention and management resources to improve health and quality of life. We have two goals for this. The first one is to assess community needs using diabetes census health data and existing resources to identify at-risk individuals and improve their access to care. We'll be doing this by conducting a community health assessment using CDC data to analyze diabetes mortality rates, existing services in the community with 211, and other resource gaps with health partners. Once we establish a baseline of at-risk community members, we hope to achieve a 50% outreach in participation by hosting free health fair events. Our second goal is to provide these resources to remove the barriers to care for low-income individuals living with or at risk for type 2 diabetes. The post-event outreach will be at least 20% of the identified individuals during health events that are high-risk participants. We're hoping to pair them with our community health partners. This will increase diabetes program utilization and support existing health programs and community partnerships. How we propose to do this is a three-prong approach. The first will be early preventive screenings. We'd like to promote annual physicals with labs and diabetes screenings beginning at age 45. This is a cost-effective strategy for reducing the burden of advanced and underdiagnosed stages of type 2 diabetes. The second part is the community intervention. By performing regular community needs assessments, we understand where the mortality rates are and where the costs are. We then identify the links between disease, behavior, and the environment as we explore if there is a risk between these things and if we can provide free screenings and health promotional activities within a community intervention. And then finally, we want to link up our stakeholders with community resources by identifying underutilized programs and support community partnerships. Lowering barriers to care is important when identifying how we're going to be funding free or deeply discounted services. We'd like to create cultural relevance within the community. We propose the Diabetes Care Fair. It stands for community, bringing people together, awareness, sharing knowledge about type 2 diabetes and prevention, resources by connecting those individuals with local services in their community, and additional education by providing accessible information about management. This will be free events taking place 4 times a year. Free events like the Diabetes Care Fair require a well-crafted community campaign when introducing this as a health promotion. Effective communication pieces, like the examples here, will help educate the community about the importance of the health fair, the services offered, and how it can benefit the entire community, leading to better engagement and health outcomes while building a culture of wellness and a trust among the stakeholders. I now will pass this on to my colleague Jan, and she will share with you stakeholders and going forward. Thank you.
The key stakeholders that will benefit from the Care Fair mission, goals, and objectives and meet the community needs are community members at risk, community healthcare and well-being partners, city planners, the health department, and other resources. The community members at risk will gain increased care and diabetes education resources, free health screenings at all health fairs, and healthcare relationships with community health partners. Community healthcare and well-being partners will gain increased existing program utilization, promotion of diabetes management, building trust through interpersonal interactions within the community. City planners, the health department, and other resources will gain building stronger connections among all community members, a demonstration of commitment to the community's well-being, removal of obstacles to prevent access to health programs. The needs assessment summary addresses three key health priorities: social determinants, food insecurity, socioeconomic disadvantages, all of which are encountered by individuals with type 2 diabetes or individuals at risk for type 2 diabetes. All are crucial in combating this healthcare issue. Competence regarding factors of cultural influences, nutritional education, and access to healthcare, in addition to other listed concerns, are a few of the areas that the care fair will focus on for improvement. Individuals diagnosed with diabetes will continue to increase in numbers until proactive measures are put into place to combat this risk of obtaining this health condition. Program intervention and activities 1 and 2 connect individuals diagnosed with type 2 diabetes and individuals at risk for type 2 diabetes to vital community resources whereby community providers collaborate efforts to provide diabetes education, diabetes management, access to fitness exercise programs within the community where the individuals live, location of healthy food stores offering healthy meals and snack options, again within the vicinity of where the individuals live, clinics providing testing that is free of charge, as well as diabetes testing kits and healthcare follow up information. Program interventions and activities 3 and 4 connect individuals diagnosed with type 2 diabetes and individuals at risk for type 2 diabetes to peer mentor supports who are able to provide invaluable coaching and motivation, transportation services and access to and from medical appointments, access to programs like the YMCA Diabetes Prevention Program and the Diabetes Lunchbox Program, which is utilized to prevent feelings of isolation. The evaluation plan focuses on two evaluation questions and two indicators. Evaluation question number 1: has the information, tools, and suggestions presented in the health assessment general information been used to demonstrate and increase diabetes awareness and access to community access among low income and at risk residents by 50%? Indicator 1: participants' consent forms will be collected and measured for all 4 health fairs, comparing the baseline and collection after 1 year with the 50% achievement goal per attendance and baseline data. Evaluation question number 2: has hosting the diabetes care fairs positively impacted low income individuals' access to resources and prevention tools, increased program utilization, and supported positive changes in at risk behaviors? Indicator 2: pre and post participant surveys will measure existing data, diabetes knowledge, and at risk awareness to access the impact of the health fair activity screenings and resources. Follow up survey results will compile data on increased participant health program utilization. Participant consent forms will be collected and measured for all 4 health fairs, measuring against baseline and again, information collected at 1 year with the 50% achievement goal per attendance and baseline data. Next presenter is my colleague, Lauren.
The logic model, as shown here, proposes using CDC health data to create a baseline aggregate data of the target community effort. From this, program planners will work with existing community resources to create a free health fair that provides health screenings and educational opportunities for individuals in the community at risk of developing complications from type 2 diabetes. Following Goal 1, program planners will establish a baseline of community members and achieve a 50% outreach participation within the year for the free health fairs. Following Goal 2, there will be an increased confidence and diabetes awareness of the target population, at least 20% of identified high-risk participants, and enroll them in community services. Our implementation timeline is shown here. We are projecting month 8 to be the month that we'll be ready to have our first health fair. Months 1 through 7 will require needs assessment, working on partnerships within the community, establishing vendors, and progressively increasing our marketing as we get closer to month 8. Month 8, we will have some data coming in from our pre-survey, so all of our folks that come in the door that get a survey before they attend the health fair, and our post-survey as they're exiting the health fair. Month 9 is when we will set up our 1 month follow-up our 1 month, follow-up post-survey from our health fair. Months 10 through 12 is where we will analyze data and look to plan our future health fairs and opportunities to improve. Our projected budget, we project about $5,000 will go into creating our health fair, each health fair. We did find through some research that we are actually able to apply for a CDC grant, which will help offset the cost of this or potentially even alleviate any cost to this. That will be to be determined. Looking at some potential barriers and cultural competence, things we want to take into account. Transportation and location. So we want to make sure that our health fair is accessible. It is easy to access, whether it be through public transportation, but also parking. So if folks are going to drive themselves, we want to make sure there's adequate parking so people, aren't driving around or can't find a spot. Also, evaluating our community vendor access. Same thing. If we bring in a bunch of vendors, but they're not accessible to our target population, again, via public transportation or adequate parking somewhere, then our community members are not going to utilize them. Looking for opportunities for multi-purpose care centers. So do we have any community partners where, let's just say, you get one bang for your buck? Maybe in the same building, you have a primary care, dietitian, rehab services, you name it. Are folks able to go to one location and easily access their services in one spot, perhaps multiple appointments on one day? Are there vendors out there where technology can help increase services? For example, if you have somebody maybe that works, let's say, long hours, 2 jobs, they really can't take time off certain times. Can they do virtual appointments? Is there technology that can help them with these resources as well? Making sure that all of our vendors are inclusive of our target population. And this is going to be very important during our needs assessment. We may know, for example, certain things that would be beneficial to them. However, our target population, we want to make sure from their end, what are they, not only, for example, for diet, what are culturally acceptable foods? What are activities that they like to do? So making sure we include things that are important to them as well. Having role models, people with similar backgrounds oftentimes are important messengers for their peers. And then also our marketing materials. We want to make sure we're culturally competent with all of our marketing materials. Ethics, we're looking for good equity in all of our data collection. We want to make sure we get data collection from everybody and making sure when we do our analysis, we're kind of comparing it to the needs of our target population and potentially looking for external auditors in the future. So at some point, do we actually have with our internal team an external group? And how are we going to disseminate this to all of our stakeholders? So our community members, we will look to have town halls and community newsletter kind of showcasing everything, showing pictures and getting quotes from participants. Our community health partners, we plan to give them a report. And our city planners, looking to have them also join our town hall and have a presentation from us again after our first one. So we'd like to thank you for your time, and please note that this full presentation, including our speaker notes, will be available to you all at the conclusion of the presentation. Thank you.